Okay, last part for the renal system. We are continuing from slide 101. We're talking about CGN. You can see that it's the combination of a few diseases affecting the glomerulus with a progressive course, meaning it gets worse. That results in chronic kidney failure, meaning that the kidney cannot, conduct its or fulfill its mission. Um, Usually, prior to diagnosis, you'll find some kind of kidney disease history, meaning it is secondary, um, and it may be highly associated with hypercholesteremia, meaning high levels of cholesterol in the blood. And then also the existence of protein in urine. Um, you can see that DM and lupus erythematosus are secondary causes, um, but the primary causes are unclear, meaning the primary form is idiopathic. Um, Trying to see if there's anything out of the usual to indicate. You can see on slide 102, second bullet, that end stage renal failure, which is, as it's called, end stage. It's the end of the line, are possible complications, and that is a severe form of renal disease. Um, and now we can start talking about nephrotic versus nephritic syndromes. We'll talk with a nephrotic syndrome first. Excuse me for a second. There we go. Um, you can see that we have the excretion of 3.5 grams per day of protein in urine um, due to some kind of injury to the glomerulus. This is the definition or how you diagnose it. I want you to remember that, please. And you can see that causes may include minimal change disease, also known as lipoid nephrosis, MGN, focal segmental glomerulosclerosis, meaning scarring of the glomerulus. What else? It's associated with drugs, with infections, um, with vascular disorders, tumors. Obviously, um, the outcomes become more severe when it's secondary, meaning there is an underlying disease or a disease in the background. Um, any any effect to the membrane is obviously going to make things worse, especially the basement membrane. Um, and then you have sometimes increased to massive loss of albumin in urine, um, which is going to affect also liver synthesis. What else? You see here a bit about albumin. You can read that on your own. And then we have immunoglobulins, LG loss, which is going to decrease the immune response and increase the chances of infections. Um, then we could talk about nephritic syndrome. Once again, remember the difference between syndrome and disease. Um, might include microscopic hematuria, meaning blood spots or small blood spots in the urine, uh, probably protein in the urine as well. Um, you can see that it's associated more with post-infectious inflammation of the glomerulus, RPGN, and nephropathy, LN, DN, And of course, these are all connected to immune injury. Then in advanced stages, you see that we have hypertension and uremia. Basically, if you think about it, these syndromes kind of take multiple clinical conditions and give them one um, umbrella or canopy phrase. Then we can talk about acute kidney injury. So we're talking about a sudden, emphasize on the word sudden, decrease in kidney function and GFR. And you see that we have nitrogenous waste products in the blood, so it's reaching the blood. That's a very bad situation to be in. Um, Indicators include, as we talked before, elevated plasma creatinine and urea nitrogen. Nothing new, just integration of the idea. And then you can see the rifle acronym that is used to classify renal injury. So the R is that you are at risk, the I is actual injury, F, failure, right? L, loss of function, and then E is the end stage kidney disease. So obviously, when you go from the R to the E, things become worse. Um, then you can see that RI, renal insufficiency, refers to a decline in renal function of about 25% of normal GFR, meaning that your GFR is going from 100% to 75, which you can see is equal to up to 30 milliliters, or give or take 1 ounce per minute, not per day, per minute of GFR. Obviously, that's a great loss in total. Then you see that serum creatinine and urea are elevated. When you go to renal failure, RF, that is the significant loss of renal function that requires dialysis. Um, and then you can see that end stage renal failure, ESRF, refers to renal function of less than 10%, requiring dialysis or kidney transplant. So that's quite a loss. Uh, Sorry. Okay. I apologize for that. Let me just lower the volume here. Okay. So, moving on to pre-renal acute kidney injury, we're mainly talking about hyperperfusion, renal hypoperfusion, due to decreased filtration pressure, meaning the mechanical gradient, is not allowing enough pressure to allow high filtration, and that will obviously lead to a decreased GFR. Um, it can be caused by renal vasoconstriction, hypotension, anything that's going to decrease the mechanical pressure and change the gradient in such a way that you don't have a flow into the renal system as you need. So that's, just a general condition. Once again, you have the mechanical gradient. Fluids flow from high pressure to low pressure. In this case, you're not producing a high enough pressure that will cause the flow in the right direction. Then you have internal or intrinsic acute kidney injury. Then you can see that it has to do with ATN, with acute tubular necrosis, meaning you have an advanced condition of the inner cells of the tubulars. In this case, you can see that it's related to PAKI, post-renal uh, acute injury, nephrotoxic, ATN, meaning toxins causing cell injury, vascular disease, transplant rejection, meaning you've undergone a kidney transplantation and you are rejecting it. Um, it can go all the way to systemic sepsis, which is a very advanced inflammation and infection of the whole system, very severe, can cause burns, as you can see. Um, it can be caused by burns, sorry, as you can see, and it's a complication of or secondary to other complications that you might have. Post-renal acute kidney injury, um, usually due to an a UTO, sorry, that affects both kidneys at the same time. This is, of course, problematic because uh, usually one kidney is supposed to compensate for the other. You can see that it's going to affect uh, in a worse or more severe way the system, the renal system. It includes bladder outlet obstruction, prostatic hypertrophy, bilateral urethral obstruction, tumors, and neurogenic bladder. In other words, nothing's left on the list that stays untouched. Then you see that several hours of anorexia with flank pain, followed by polyuria, is a unique pattern. So you want to remember that. Um, what else? One of the major symptoms is decreased urine output. And then you see the three mechanisms. I think they're pretty simple to understand. If you catch it on time, it's preventable. Nothing that, and basically you see that it encounters, sorry, excuse me, it includes everything that we've talked about. So everything is going for the worst, and multiple aspects of function are being affected. It's just look at the list. Every slide just adds to the list of everything that can go wrong in the renal system that is happening. Then you have chronic kidney disease, CKD, uh, which is obviously progressive and permanent. So the progressive loss of renal function, you can see that it's associated with a systemic disease. You see that GRF is decreased by 60 milliliters per minute for the duration of at least 3 months. So that's the definition that you need to remember um, in order to diagnose. And I want you to remember that definition. And of course, then it's regardless of the cause. And then notice in slide 131 that you see changes in all system organs, meaning that this is spreading to the whole body and you're looking at a very fast collapse. What else? Then, of course, the adaptive or the ability to compensate is maxed, and you can no longer mask the dysfunction because we talked earlier in one of the videos about compensation. Now there's no compensation. The system is maxed, and you're going to see the dysfunction in full-blown spectrum, so to speak. So at first, the adaptive kidneys or nephrons show what we call hyperfunction. They increase their function to try and compensate. then they expand, leading to hypertrophy, and at some point, it's going to be too much, and they'll just collapse. Okay, so that would be the equivalent of a person filling in for someone at work. The more workers that don't come to work, the more you need to compensate. At some point, you are maxed with your ability to work, and you're going to collapse at some point. So you have the schematics, the schemes that you can look on slides 135 and 136. I think they're pretty simple. You don't have to remember every part of them, but remember the idea and the order. Pretty simple, basically. It's the same things that we've talked about before. Obviously, you can see that part of the disease is structural alterations, and you know by now, in principle, that once you alter the structure, you alter the function immediately. What else? I think that it's worth mentioning in slide 139, the hallmark of CKD is acid-base disturbance, meaning you have an imbalance of the buffering system. Obviously, in this case, it's electrolyte imbalance, and electrolyte imbalance always is going to affect your nervous system. So that's not fun, to say the least. Um, of course, you can balance electrolyte loss through diet. So that's something that you can, of course, um, give at least a partial solution. You're not fixing the problem, but you're giving a solution, at least temporary, until you get it established. What else? Trying to look at anything that we haven't talked about in principle. Nope. So I don't see anything worth mentioning, but if you do have questions, as always, send them my way. So this was the last part for the renal system. Remember the principles, notice how they reoccur. And the last part of the presentation, obviously, are terms and conditions that kind of encompass whole situations, rather than the first part that talks about specific dysfunctions. But notice that they're still left at a very um, unspecific level, so to speak. We didn't go into chemistry, we didn't really go into hormones too much, as seen in the endocrine system. So, very basic principles reoccurring again and again. Untreated, it expands and causes worse symptoms. If you have questions, send them my way. Bye.